Okay, just wait a minute or so while everyone joins. Okay, I think we're ready to get started. So hi, everybody. Welcome to tonight's live virtual event. We're really excited to have you here. A lot of Calibrate members, as well as some prospective members. And I'm Danielle. I'm the community manager here at Calibrate. And we're looking forward to sharing with you a little bit more about Calibrate, as well as, dive into sleep. We'll also be recording this event tonight. So we will be able to share this with you guys tomorrow and follow up with you with all the great content that we reviewed tonight. So tonight we're joined by Calibrate Chief Medical Officer, Dr. Kim Boyd, as well as our sleep expert, Dr. Ellen Vora. So Kim will kind of talk through a little bit about Calibrate, and then we'll dive into sleep with Ellen. Feel free to drop in a question in the Q&A section of the Zoom, and we will get to those at the end. We'll leave about 10 minutes at the end for questions. We also got some questions for social that we'll go over. And if we don't get to your question tonight, don't worry about it. We will follow up after this event sometime next week and make sure we address all the great questions that we'll get here tonight. So before we get started, I would love for Kim and Ellen to introduce themselves, give a little bit of their background, as well as what they do at Calibrate, and then share what we call our 4-pillar lightning round. So that is your favorite food, your favorite sleep tip, your favorite type of exercise, and then your favorite emotional health tip. And before we do that, I just wanted to share this really great quote from one of our speakers tonight, Ellen Vora, which is, "Sleep is a built-in takeaway toolkit that will improve every aspect of your well-being." So I think that's just a great way to set the stage for tonight's conversation. So this is just a little overview of everything that'll be happening. So Kim, take it away.
Great. So nice to be able to be with everyone tonight. I am Kim Boyd. I'm Calibrate's Chief Medical Officer. I'm a family physician by training and did a fellowship in integrative medicine. So I have a more holistic approach to how I think about health and wellness. And I have been with Calibrate since very early days, when Calibrate was just sort of initial idea, and have helped build out the program. At Calibrate, I oversee the medical teams and the medical part of the organization, as well as the curriculum, and work on the lifestyle interventions that we use to change habit and improve weight and metabolic health. So a few of my favorites. I can't really go through a day without nuts. Those are a great go-to. Maybe not the most exciting thing, but for me, they're just a really, really great core staple. Sleep tip, keeping my phone out of the bedroom. I am a real person, so I don't always do that as well as I should, but I know I feel a heck of a lot better when I do. Exercise, I have 2 young kids, and so I'm often chasing them around. I also love yoga and walking. And then emotional health, just finding those moments in the day that are opportunities for gratitude, and recognizing them and reflecting on them is a practice that I'm able to actually do on a regular basis. And I find it just brings a lot of joy and attention to the good things in life for me.
Love that. Thanks for sharing. Ellen?
All right. Hi, everyone. I'm Ellen Vora. I am a holistic psychiatrist, which is not really a household term. So you can just think of me as like a weird psychiatrist. I went through med school and residency and came away from that deeply disenchanted with how our conventional system approaches mental health. So I've gone on to study Chinese medicine and acupuncture and functional medicine, and all of that informs how I approach sleep. And I have a book coming out in April about anxiety. And my favorite food, it really depends when you ask me, but I guess at this moment I put down papaya, which is definitely one of my favorite foods. It is my favorite fruit. And my sleep tip overlaps with Kim's, but it has been the most powerful intervention that I've done in my life, is to just not bring the phone into the bedroom. Also, like Kim, I'm also a real person. And once in a while, it doesn't go that way. And I always learn proof of concept every time. When I bring it in, I stay up later. I don't sleep as well. I wake up throughout the middle of the night. And I love hiking. I live in New York City, which is kind of a concrete jungle. So I don't do a lot of hiking in my day-to-day life, but when I can, I take a walk. And then in terms of emotional health, I really think that we as a culture need to reframe our attitude around crying. I think that when we cry, we apologize, we try to suck it back in and make it smaller, but it's quintessentially human. I think it's the wisdom of the body giving us a chance to have a release. And I think we need to lean into crying, cry more often and let it be big.
I love that. It's great. We always say in my family, like sometimes you just need to let it all out.
Yeah.
Really helpful. Great. So next, I'm going to ask him to share a little bit about Calibrate and what it is for those on this call who might be new to Calibrate or interested in learning more.
Sure. So Calibrate is a comprehensive one-year program that works at addressing weight in the context of metabolic health. And it combines a few core elements. So it combines medication, and specifically GLP-1 medication, and we'll go into that a little bit more, along with this intensive lifestyle intervention. And that's the technical research term, but what that means is habit change. And we do that intensive lifestyle intervention habit change across 4 core pillars that have a dramatic impact on weight and metabolic health. So those are food, sleep, exercise, and emotional health. And we know that when you combine this medication along with this intensive lifestyle intervention, the results are twice, if not even more than twice as good as if you did either one of those alone. So to circle back a little bit more to these GLP-1 medications that Calibrate uses, these are categorically different than some of the historic weight loss medications that we may have heard of in years before. The GLP-1 stands for glucagon-like peptide 1. That is a hormone that's naturally secreted by our body. The medications are analogs. They work on those same receptors as the hormone that naturally occurs in our body. And these hormones have a lot of really important effects across our physiology, ranging from reducing inflammation to influencing how our body processes blood sugar and insulin. They also affect appetite, which is how hungry we are, and satiety, which is how full we are. They work on the brain and some of the areas that are involved in our weight set point. So that's a really, really core component. But we know that part of the reason that they really work and that they can be sustained is when they're combined with this lifestyle change through the Calibrate curriculum and the small incremental steps that we make to changing habits. And one of those core pillars, as you've heard, is sleep. And so that's why we're here today.
That's great. Tell us more about sleep, Kim. How does it fit into the Calibrate program and what does that look like?
Sure. So Ellen is going to go into a lot more detail around exactly how and why sleep is so critical for weight and metabolic health. But it is a profound restorative time for our bodies. That's when a lot of the repair work and regeneration happens, and when kind of hormonal levels are set and influenced. So it's a really, really important part of the Calibrate program. And frankly, even just to zoom out a little bit, it's a little bit radical that sleep is even part of a weight program, but it is so, so critical to our health and well-being for all sorts of things that we would really be remiss if we didn't have it as a core pillar. So the Calibrate goals are to really get people to an amount of sleep that will be consistent for them and restorative. And for most people, optimal sleep really is closer to the 8 to 9 hour range, maybe 7 to 9, but most people really do better at that 8 to 9 hour range. And so again, Ellen will go into all of the awesome nerdy biology details that I love and explain it in a way that's really accessible, which is also fantastic. But the sleep is a really core part of the program. And as you go through the Calibrate curriculum, we have lessons about sleep that you learn in each of the levels of the program, and they build as you progress through the program. So when you start, you learn about why sleep is important, and you start with just making some very small changes to sleep hygiene. And then as you progress through the program, you continue to work on some additional goals that help you to really optimize your sleep schedule so that you are getting the rest that your body needs to be its healthiest.
That's great. Thank you for sharing. Next, I want to ask Ellen a couple of questions to dive a little bit deeper. So my first one is, Why is sleep important for overall health?
Yeah, so let's nerd out on sleep. It's basically our best, most important medicine. And that's true for weight loss, for maintaining a healthy weight, but it's true for so many other things as well, for our immune health, which is of utmost importance these days. If we want to be able to remember what we learn in a day, if we want to be calm and patient with our kids the next day, if we want to be creative, if we want good skin, if we want to live a long, healthy life, it's important across the board and absolutely central to mental health. And so it's our best medicine.
And what impact does sleep have on weight?
So it really impacts weight, I would say, across three main pathways. There's the fact that when we don't sleep well, in the next day, we're in a stress response. So we have higher levels of our stress hormone, cortisol, which drives a lot of interesting things. It influences our appetite and our cravings. So we're more likely to crave things like sugary foods, carbohydrates. It changes how our body manages blood sugar. So we're more likely to be insulin resistant. And then it seems to promote the deposition of what's called abdominal adiposity, but basically that most inflammatory and kind of stubborn way of depositing fat in our middle section. And then a really interesting pathway is around these hormones called ghrelin and leptin. And my mnemonic for remembering this is maybe not that kind towards gremlins. I don't know, but I think that when we don't sleep well, we have higher levels of ghrelin. And what ghrelin does is it drives us to eat. It increases our appetite and our cravings. And it actually, when we don't sleep well, we have lower levels of leptin. And leptin is the hormone that lets us feel full and content, helps us with satiety. And so, ordinarily, if you got good sleep, you have good levels of leptin, lower levels of ghrelin, then maybe you exercise and you go for a while without eating, and you have just the normal amount of ghrelin, and you have a good appetite, you enjoy your food, and then you get leptin after you've eaten. But when we're sleep deprived, all of these levels are out of whack and our ghrelin is way higher and our leptin is lower. So we're driven to eat more. And there's also this interesting slightly more indirect pathway, which is that a lot of our choices about how we feed ourselves relies on what's called executive function. And this has to do with parts of the brain like the prefrontal cortex. And I think of this part of the brain, it's like this tiny little reservoir, and it's very finite. And anytime we try to make better choices, anytime we try to be patient in a difficult situation, even if we try to take a moral high ground and do the right thing in the face of adverse situations, that is a withdrawal from our reservoir of executive function. And so when we don't sleep as well, we've withdrawn a lot from it. We don't have as robust of a reservoir of executive function. It becomes harder to make good choices. And that's around our day-to-day activities. And it's absolutely pertaining to how we feed ourselves and what we might opt for. And so there's more to it, but sleep impacts how we feed ourselves and how that all works physiologically within our bodies.
Awesome. And one of the things that I'm excited to hear about next is some of your sleep hygiene tips, because I know you have a lot and some really good ones that I think will be really beneficial for a lot of people on this call. So we picked out some here, and I would love for you to just dive into each one of them. Tell us a little bit more about them and how they can impact your sleep.
All right, let's do this. This is up till now, it's been the why this matters. And now it's like the brass tacks strategies, actionable takeaways. So this is where take your screenshots or pay attention. So basically, I believe that many of us are not sleeping because of these seemingly benign, really common aspects of modern life are disrupting our ability to sleep. And it really comes down to our circadian rhythm. That's our sleep-wake cycle. And it is cued primarily by light. And that was actually a brilliant design by evolution, because if it's light out, it's by definition daytime. And then if it's nighttime, it's going to be dark out. So it's a really good system to help humans be awake during the day and tired at night. And I don't fault them for not anticipating the fact that we were going to invent a light bulb, and then eventually the iPhone, and eventually Netflix, and then Tiger King. And so now nobody sleeps anymore. And it really comes down to light. And we can outsmart this a little bit and get strategic and make slightly different choices that fix our light cues and protect our circadian rhythm so we can get back to sleeping. And there's a lot that goes into this, but it starts by making sure you get bright light during the day. And what that really looks like is opening your blinds first thing in the morning, getting outside, even if you're working from home, try to fake a commute, even if it's just 2 minutes out on your front stoop. And then the real special sauce comes in after sunset. That's the part that's most twisted in modern life. It used to be that the sun would set and then we had darkness, save for the moon and a fire. And now we are surrounded by a psychedelic light show of overhead lighting and our laptops open on the couch while we're watching TV and the phone comes into the bedroom with us. So things you can do to correct light after sunset. You can power down electronics. We all say that, none of us really does it. What I think is a really nice strategy that actually makes a difference and it's easy to do is to get a pair of blue blocking glasses. And what these do is they block all blue spectrum light from getting into our eyes. And that way the light around us can't disrupt our circadian rhythm quite as easily. And you can get ones that look ridiculous like this, like you're about to go do, I don't know, like metallurgy or fly fishing. Or you can also get ones that look a little bit more normal. These are, I think, Felix Gray, and they look generally okay. I just look a little bit like just a little orange. And I put these on at sunset. I wear them until bedtime. And I notice the difference 1000%. If I forget to, if for whatever reason I don't have them with me when I travel, then anytime I'm looking at a screen, I'm getting exposed to blue spectrum light and it disrupts my sleep. If I wear these, I can fall asleep at bedtime. The other most impactful intervention that we can do to protect ourselves from light is to get the phone out of the bedroom. So this one now you've heard 3 times today. It feels intimidating in anticipation because we rely on it. It's our alarm clock. It's our lifeline. It's how we distract ourselves from stress at the end of the night. But see if you can overcome some of those obstacles. Get an alarm clock. It's not a very hot commodity these days. They usually sell for like less than $10. And then set up your settings so that you could still hear an emergency call from the other room. But basically get in the habit of reading a paper book in bed and have that be your winding down process once you're in bed. And the trouble with the phone in bed is partly the blue spectrum light. It's partly the fact that it's designed to be addictive. There's no natural stopping point. No one has ever said to themselves, look, I just got to the end of TikTok. Now I can put my phone away and go to sleep. It's designed to have us scroll endlessly because we live in the attention economy. So they are brilliantly engineered to hold our attention. And then now these days, we're constantly doom scrolling, which is one thing during the day, keeps us informed, keeps us engaged in the public conversation. But right before bed, it's really just serving to put us in a stress response right as we're trying to relax into sleep. And then beyond light, another strategy that is surprisingly effective is to actually aim for a slightly earlier bedtime. And this one took me a long time to realize. I basically had to have a kid. And when I had my daughter, I noticed that she has her little tired signs. When she's tired, she rubs her eyes, she yawns, and it's so cute. But what I realized and learned sort of the hard way is that that's not cute. That's an emergency. If you see a tired baby, you have to drop whatever you're doing and change the diaper and swaddle that baby and put this pile of dynamite sticks into the crib and get out of there before it's too late. Because babies have a window, a sweet spot when they're perfectly tired and they'll fall asleep and they'll stay asleep. But if you miss the window, they're what's called overtired. And if you don't have kids, you're like overtired. That's not a thing. You get tired and then you get more tired. But if you have kids, you're like, yeah, I learned that the hard way too. So it took me a while to realize adults, we are really just gigantic toddlers. We also get overtired. So start to recognize in yourself, what are your tired signs? For a lot of us, we yawn. We might be falling asleep on the couch around 8:30 p.m. and thinking, well, that's not bedtime. That's just a little pre-nap. And so also notice your overtired signs. For me, I know that if I push past my tired window, I get this feeling of like a second wind and I feel suddenly kind of warm. That's the cortisol now rushing through my veins. And I want to go down an internet rabbit hole or clean the kitchen. So once you notice this, if you see your tired signs, that's going to be the time you want to change your diaper, swaddle yourself, put yourself in your crib. If you need a little hack, looking for that around 3 hours after sunset is usually a safe bet. And then our physiology. And this one is full of unfun, inconvenient truths, but basically caffeine does play a role. I know that nobody likes hearing that because caffeine feels like our one true friend in the world, but we do have to recognize it has a long half-life. And sometimes if we're having coffee in the afternoon, there's still a decent amount of caffeine buzzing around our brain when we're trying to fall asleep. Blood sugar is kind of an easier fix. That's where if you know that your blood sugar is swinging throughout the day, if you identify with the concept of getting hangry, that's a pretty good indication. Hangry during the day means you pick a fight with your partner. Hangry overnight means you're waking up at 3 a.m. with kind of a vague headache. So if that's you, the definitive solution is stabilizing your blood sugar around the clock. But a hack that you can use in the short term is to do something like a spoonful of almond butter or coconut oil right before you brush your teeth at night. And then I like to recommend magnesium glycinate. It's a really safe, helpful supplement to take that supports sleep. I think it's more effective and more helpful than melatonin, which is what is a very popular choice. And I'll say the last hack is how you get around prioritizing sleep. And there's a term now called revenge bedtime procrastination, which I think many of us can identify with, where you feel like you have no time to yourself, no time to decompress, and you rebel against that in the evening by scrolling and being like, your partner's like, shouldn't we go to bed? And you're like, leave me alone. And so what you want to do instead is start to realize, how do we create a life during the day that we don't need to rebel against at night? And for me, what really made the difference is I thought those last 30 or 45 minutes before bed was when I was getting important stuff done, was when I was getting time to myself. But what I eventually realized is that those 45 minutes were squandering my energy for the entire next day, and it was no longer worth it. I just finally saw that math and it didn't check out. And so that's the final hack. There's plenty more to say on that, but I look forward to answering some questions.
Yeah, that's a great one. That last one, especially, I feel like now that a lot of people are working from home, it's really hard to find that separation, and that becomes a lot more harder to have that time to yourself in the evening for sure. Okay, great. I'm gonna open up the Q&A section. Feel free to drop any questions you may have in there. And before we do that, before we get to some of those questions, or you can drop them in the chat if you want to. Before we get to those questions, I'm going to share a couple questions that we got on social. So the first one, which I think is probably really relevant to a lot of people here, is any advice or tips for people who work night shifts and have irregular hours of sleep?
Yeah, so night shift is a topic near and dear to my heart as someone who went through med school and residency, and I worked the night shift, basically every 3 or 4 nights for years on end. And I take it really seriously. I do want to not sort of rose tint or sugarcoat the fact that it has real risks. And what we see is it comes with risks to our metabolic health. There's even questions around that loss of melatonin release because you don't have darkness overnight, which can impact even like nascent cancer growth in our bodies. So I don't approach it lightly, but I also understand sometimes it's an inevitability. So if you have a pathway to moving away from it in your life, it's great to take steps down that path. If it's unavoidable, let's make the most safe and sort of tenable version of it. So what I eventually learned how to do for survival mode when I was working the overnight shift was resisting any temptation to sort of feel awake in the morning after an overnight shift. I would get on the subway after an overnight shift and everyone would be there with their fresh makeup and their coffee that smelled so good. And I would want to drink a coffee and then go out and walk around the city. And what you actually have to do is kind of put on your blue blocking glasses, go straight home. I would walk in the front door, strip off my hospital scrubs, and I would shower, draw my blackout shades, take some magnesium with a glass of water, eye mask on, and go straight to bed. And that was not a very fun life. There wasn't a whole lot going on in my day-to-day life, but that was the way I was going to best protect some semblance of a circadian rhythm so that I got adequate sleep, got adequate darkness, and was able to kind of keep going with that without getting completely, just all the springs popping out of the machine.
Yeah, for sure. Another one we got from social, which I also think is a good one, is should we sacrifice our sleep to fit in exercise or a workout?
Yeah, I love that question. I think The answer is no. I think that sleep is kind of a workout in certain ways. Like if you really, if you're, there are so many reasons to exercise, but if this is about longevity, health span, weight loss, feeling good, I do think actually sleep is the without which not. You kind of like need that as your foundation. And if you don't have that, no amount of exercise is going to get you there because of the ghrelin levels and the cortisol levels and so on and so forth. And I think if there's just simply not enough hours in the day, you prioritize and protect the sleep. Don't like set your alarm extra early so you can get up and do this like aggro workout in the morning and sacrifice sleep for that. And then I recommend lowering your standards around exercise. And that might not be a fully calibrate idea, but I think for me in my life, yeah, Kim, you want to add something?
No, it is. It is.
Oh, great.
Starting where you are and being able to find movement in a way that works. So
Yeah.
yes, keep going, keep rolling.
Exactly. So yeah, so I just lower my standards for exercise. So I certainly don't set the alarm early. I don't do some kind of perfect workout in the morning. I fit in 10 minutes, sometimes 5 minutes, sometimes 2 minutes, sometimes 20 minutes. And that's what I do. And that's what's actually like a bite-sized piece I can realistically build into my life. Yeah. And I see lots of questions in the chat now too.
Lots of questions. One of the themes I'm seeing is like a lot of questions about waking up a lot in the middle of the night and then how do you fall back asleep?
I love that question. Yeah. So middle insomnia or waking up in the middle of the night, that is many things to me. I think that one common culprit is a blood sugar crash, like I mentioned before. So a really nice thing to try out for yourself is a spoonful of almond butter or coconut oil, really anything that's kind of either close to pure fat or fat plus protein. Some people actually recommend using honey for this. I have other issues with that, but honey is also really nice. If you really just want to protect stable blood sugar overnight, honey is also a decent option. And if that solves the problem, there you go, it was blood sugar. And the definitive solution is still working towards a blood sugar stabilizing diet overall. I also think alcohol plays an underappreciated role in middle of the night wake ups. And alcohol is a tricky thing when it comes to sleep. It basically causes this rush of we're going to nerd out for half a second on alcohol. It causes a rush of GABA, which is this neurotransmitter that helps us feel relaxed and calm and confident. And that's why we like alcohol. But then the brain thinks, well, what if a leopard came around the corner? I'd be too buzzed to survive. So it converts that GABA to something called glutamate, which is an excitatory neurotransmitter. And if we were drinking at dinner time, that glutamate hits our brain around 2 or 3 a.m. And that's why we wake up and we're like, I really don't feel well, but I also can't sleep. And that's the feeling of the GABA turning into glutamate. Also causes a blood sugar crash. So those are some things, but stress is also a huge factor. And the more we can manage our stress during the day, the less cortisol we're going to have coursing through our veins, making our sleep more superficial overnight. And sleep apnea is always something to be aware of. If you're not breathing sufficiently overnight, that's going to impact your ability to sleep deeply.
Yeah, for sure. Another kind of interesting one that I'm seeing in here is from someone who is a volunteer EMT, which is really cool. And this kind of goes back to the first question that we had about, people who have irregular sleep hours, but their question is more around how do they recover and kind of like, I would say like catch up on their sleep, so to speak, after, they have all these unpredictable, shifts.
God, it's so tricky. I've lived this. I'm not sure I have the answer. I think that there's really tough trade-offs, as this person sounds like they're fully aware of. The way I handled it, I'm not sure this is definitely what I recommend, but the way I've handled it is to catch up on sleep. And it's controversial. Some sleep experts would say, no, keep it consistent, even if you don't get to catch up on sleep. What my body has always seemed to want to do is if I'm sleep deprived, hanging off of some shifts or late nights or whatever it is, I give myself the space to catch up. Of course, that has been completely inaccessible since I've had a kid, but that's what I used to do. And I think that there is something to be said for what is sometimes called social jet lag, where it's like on the weekdays, bedtime is this time, and then on the weekends, it's pushed a little later. And then the Sunday scaries is some combination of like trying to fall back asleep early again for Monday morning and struggling with that. And so working in irregular hours is another way of having a kind of jet lag in your day-to-day lives. And it's really tough. And I think that it's sort of like with shift labor, if you can ever work towards more consistency, which usually is sort of like a seniority thing in these kinds of jobs, like that's a long-term goal. And there's a lot of years where we're paying our dues and it's not easy.
Okay, great. There's one more question I think we can take before we wrap up, because it just came in and I think it's a really good one. What about napping?
Yeah. And I see also a question around magnesium, so I'll answer it really quick because a lot of people, magnesium glycinate is over the counter. It's not prescription. And for most of my patients, I have them buy like a magnesium glycinate that comes in like 100, 120 milligram tabs. And you can start with one, you can increase. Some of my patients take like 200 or 400. Some people take up to 800 milligrams. If you get loose stool, that's how you know you're taking too much, and ease it back. And you can just play around with it, take it with water, maybe half an hour before bedtime. So napping, surprisingly controversial. It really depends. And I think that you kind of have to figure out your body's rhythm. And if you're in a rhythm where you go to bed at a certain time, wake up at a certain time, and you still carry like an hour debt in your body, and you have some kind of flexible job where you can take an hour nap in the middle of the day, in the afternoon, and if that's working for you, enjoy that nap. If we're inconsistently napping, sometimes that can throw our circadian rhythm in all kinds of different directions. So then when it's bedtime, we're not as tired. And so then we stay up later, and it kind of causes this phase delay in our sleep. So you have to find the rhythm with napping. But I think generally pushing a little earlier in the day, the nap, and keeping it to 20 minutes, 30 minutes, maybe an hour is the right way to nap. And once it's like a late afternoon, multi-hour nap, at that point, when you wake up from the nap, your body's like, I guess that was my short night of sleep. And it gets really hard to fall asleep at an appropriate hour after that.
Great, thank you. Yeah, I know like a 20-minute power nap is always something that works for me personally. Okay, well, I know there's a lot of questions that we didn't get to, and we will follow up with you guys over email with all of the questions. They were all great questions, so thank you guys for submitting them. And if you have any other questions about Calibrate, you guys can hop onto our website, schedule a call with our team. We'd be happy to answer anything. Feel free to follow us on social media for more tips from Kim and Ellen and the rest of our amazing experts. And thank you guys all for joining. And I look forward to sharing out this recording and some of these tips afterwards. So look out for an email from us tomorrow. And thank you, Kim and Ellen, for being here.
Thanks, Danielle and Kim, and thanks everyone for being here and for the great questions.
Thanks, guys. Good night.
Good night.